So the greatest opportunity to improve quality at the pharmacy level involves aligning goals between providers, commonly held, quality-driven goals that lead to pharmacists really showcasing the abilities that they have, just they're natively part and parcel of the way that we deliver care. So for example, inside of the C&D star ratings, we have 3 measures of medication adherence, which is absolutely a sweet spot for community pharmacists with its high touch, high level of interaction between patients and pharmacists. Pharmacists really are a driving force in improving medication adherence. Then we have 2 measures of safe and appropriate medication use, one of which will be sunsetting. But in particular, the safety measure around high-risk medications in the elderly, that's a targetable measure that ties together not only the pharmacists and the health plan, but also the prescriber, so that pharmacists are flagging inappropriate medications in elderly patients and drawing them to the attention of the prescriber, which can actually lead to better prescribing practices, better coordination of care for those beneficiaries that are being served inside of the community setting. There are a lot of tools that are available for pharmacists specifically to target those commonly held goals, the quality-related goals between the pharmacist, the physician, and the health plan, and such as EQUIP, the electronic quality improvement platform for plans and pharmacies. Simply stated, it's a benchmarking tool embedded in 55,000 pharmacies now, where a pharmacist can see their report card exactly how they're performing on those key quality measures that are important to health plans. There are a lot of things that are coming into play in the shifts of care that pharmacists are providing. There's some narrowing of networks that are done by some health plans, which can be very alarming for community pharmacies. One way to make sure that you are very well positioned to stay inside a network or to participate in these emerging pay-for-performance programs that many Medicare Advantage and other health plans and PBMs are offering at this time is to ensure that that value proposition related to quality is just natively part of the culture for your pharmacy, not just at the corporate level and have that trickle down, but for the community pharmacist, who the PIC and the staff pharmacists, to just have that be front and center in what they're thinking about when they're delivering care and creating the culture inside of their own practice setting. So the changing dynamics, I think, are influencing the way that we provide care. I mentioned previously this rising CMR completion rate measure. That's going to put more pressure from health plans to have their community pharmacists providing that service at the point of care for patients. Now, the other dynamics that are coming into play are, I mentioned the pay-for-performance programs that are already existent in the marketplace. Well, if I know that, for example, my patient, Mrs. Jones, the 67-year-old diabetic, is receiving her diabetes medications from my pharmacy with a low adherence score, and I also know that I haven't done a CMR for her, and I need to get my CMR completion rate up. 1, I'm going to provide that CMR completion rate to help meet those quality goals. 2, I'm going to make sure that that CMR includes some information around taking her medication appropriately, given that I know that her performance scores thus far on her adherence-related quality metrics aren't quite where they need to be. So getting patients to have a good medication adherence rate and completing them CMR and tying those to incentives, that's a great way to be able to make sure that pharmacy is able to provide those ancillary services outside of dispensing that are of such high quality, that fit into our training and our desires, and that really meet the needs, the quality healthcare needs of the patients that we're serving.